Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Traumatic brain injury, TBI, is a form of brain injury caused by an external mechanical force, such as a blow to the head, a violent jolt, or an object penetrating the skull. It can result in temporary or permanent brain dysfunction, affecting cognitive, physical, emotional, and behavioral functions. TBIs range from mild concussions to severe injuries depending on the impact and damage to the brain. TBI is a major cause of disability and death worldwide, particularly among young adults, athletes, military personnel, and the elderly. Causes of TBI. The most common causes of TBI include falls, slips, trips, and falls are a leading cause of TBI, especially among the elderly and young children. A fall from a height or even a ground-level fall can lead to head injuries. Motor vehicle accidents, collisions involving cars, motorcycles, bicycles, or pedestrians can cause TBIs due to the sudden and forceful impact during the crash. Sports injuries. Contact sports like football, boxing, and hockey, or activities like skateboarding and skiing, present significant risks for TBI, especially concussions. Assaults. Physical assaults, such as being struck by an object, blunt force trauma, or gunshot wounds to the head, can lead to brain injury. Explosive blasts and combat injuries. Military personnel are at risk of TBIs due to explosions or blast waves that cause severe trauma to the brain without necessarily penetrating the skull. Types of TBIs are generally categorized based on the severity and type of injury. Mild TBI, concussion, often results from a blow to the head or sudden jolting. Symptoms may include confusion, headaches, dizziness, and temporary memory loss. Most people recover fully from mild TBIs within a few weeks, but repeated concussions can lead to long-term effects. Moderate TBI, characterized by loss of consciousness for several minutes to hours, confusion that lasts for days to weeks, and physical or cognitive impairments that may last for months or become permanent. Severe TBI involves extended periods of unconsciousness, coma, or memory loss after the injury. Severe TBIs often cause long-term or permanent disabilities, including physical impairments, speech problems, and difficulties with thinking and emotional regulation. Mechanism of injury. When the head undergoes a violent impact, the brain moves rapidly inside the skull. This sudden movement can cause the brain to collide with the skull walls, leading to bruising, contusions, bleeding, hemorrhage, and tearing, diffuse axonal injury, of brain tissue. Depending on the force and nature of the trauma, the injury may be localized, focal, or spread throughout the brain, diffuse. Focal injuries. These occur at a specific location in the brain and are often the result of direct impact, such as a blow to the head. Diffuse injuries, caused by rapid movements of the head, such as whiplash in a car accident. Diffuse injuries can lead to widespread damage throughout the brain, disrupting communication between neurons and leading to functional impairments. Symptoms and effects of TBI. The symptoms of TBI vary widely depending on the severity and location of the injury. Common symptoms include physical symptoms, headache, nausea, vomiting, dizziness, balance problems, fatigue, and sensitivity to light or noise. Cognitive symptoms, memory problems, difficulty concentrating, confusion, and slowed thinking. Emotional and behavioral symptoms, mood swings, irritability, depression, anxiety, and personality changes. In severe cases, TBIs can result in coma, a state of prolonged unconsciousness, vegetative state, a condition where the individual is awake but unaware of their surroundings. Post-traumatic amnesia, PTA, memory loss for events before and after the injury. Seizures. TBIs increase the risk of seizures, a condition known as post-traumatic epilepsy. Motor deficits, difficulty with coordination, balance, and muscle control. Diagnosis of TBI. Diagnosing a TBI requires a combination of clinical assessments and imaging techniques. Physicians may use neurological examinations to assess motor function, balance, coordination, and cognitive abilities. Glasgow Coma Scale, GCS, a scoring system to evaluate the level of consciousness based on eye, verbal, and motor responses. The GCS score helps determine the severity of the TBI. Imaging tests. CT scans or MRIs may be used to identify bleeding, swelling, or other structural damage to the brain. Treatment and management of TBI. The treatment of TBI depends on its severity. Mild TBI, concussion. Rest and gradual return to normal activities are often recommended. Close monitoring is essential to ensure symptoms do not worsen. In most cases, symptoms resolve with time. Moderate to severe TBI may require hospitalization and intensive care. Treatment often includes surgery. In cases where there is significant brain swelling, bleeding, or skull fractures, surgery may be necessary to relieve pressure and repair damaged tissues. Medications. Drugs may be administered to manage symptoms such as pain, seizures, or swelling. Medications may also be used to prevent secondary complications like infections. Rehabilitation. Long-term rehabilitation may involve physical therapy, occupational therapy, speech therapy, and psychological counseling to help individuals regain lost skills and adapt to new limitations. Long-term effects and recovery. Recovery from TBI can vary widely depending on the severity of the injury and the individual's overall health. While mild TBIs often result in full recovery, moderate to severe injuries can lead to long-term physical, cognitive, and emotional challenges. These may include cognitive impairments, problems with memory, attention, and executive function, emotional and behavioral changes, depression, anxiety, irritability, and difficulty controlling emotions, physical disabilities, mobility issues, muscle weakness, and chronic pain. Recovery can be a lengthy process, often requiring months or even years of rehabilitation. Family and social support play a crucial role in the rehabilitation process, helping the injured person adapt to changes in their abilities and quality of life. Prevention of TBI. Many TBIs can be prevented by taking certain precautions. Wearing helmets. Proper use of helmets during activities like cycling, motorcycling, skiing, and contact sports significantly reduces the risk of head injuries. Seatbelts and car safety. Wearing seatbelts and using child safety seats can prevent head injuries during car accidents. Fall prevention. Installing grab bars, improving lighting, and removing tripping hazards in homes can reduce the risk of falls, especially for older adults. Avoiding risky behaviors. Minimizing activities that may lead to head trauma, such as engaging in high-risk sports without proper safety measures or driving under the influence of alcohol. Conclusion. Traumatic brain injury is a serious public health issue that affects millions of people each year. Its impacts range from mild, temporary disruptions in brain function to severe, life-altering impairments. Through early intervention, proper treatment, and rehabilitation, many individuals can recover from TBI, though some may face long-term challenges. Prevention efforts, particularly in areas like helmet use and fall prevention, can significantly reduce the incidence of TBI and its associated consequences.